Hi, my name is Dr. Brent Quern. I'm a family physician, and today I'm going to be demonstrating to you how to do a fine needle aspiration of a palpable breast mass. When a patient presents to your office and concerned about a lesion in her breast, and you can actually feel a breast mass, it's worthwhile right then and there in the office to try to aspirate it. And it's recommended, in fact, that all family physicians and nurse practitioners do this because if the cyst is able to reduce immediately and disappear, you can actually, A, reassure the patient that there's nothing worrisome going on, and B, probably decrease a lot of anxiety that this patient is going to have. If, however, there's still something palpable or you don't get much in the way of fluid coming out, then you're going to need to move forward with two more steps: ordering a mammogram and referring the person to a surgeon or another person who's comfortable assessing the lesion. So why don't we get started, and I'll show you on our model the best way of going forward with this procedure. Now, for our model today, what we're going to be using is a Ziploc bag filled with flour, and our masses are actually cherry tomatoes. So the procedure is something that's really straightforward that you can do in your office, and as I said, I tend to do it when the patient is presenting as opposed to bringing them back for a special episode, because you can just do it in the office. Now let's talk about the equipment. It's actually pretty straightforward. You're going to need a pair of gloves, and you're going to need a sterile syringe. I would recommend a 10cc syringe, which tends to work the best, and a needle. You can use anywhere from a 22 gauge to a 25 gauge needle, either an inch to an inch and a half long. For today's demonstration, we're going to be using a 25 gauge 1 inch long needle. Something for cleansing the skin, povidone and or alcohol. I always have some gauze. Now, normally I use just a dot band-aid, the same type of band-aids that we use after immunizations. But sometimes if the wound is oozing because you've gotten a superficial blood vessel, I'll create a pressure bandage with a little bit of the gauze and a bigger band-aid on top. So before you perform the procedure, you should review possible complications with the patient. These include the potential for infection, the potential for a small amount of bleeding, and the theoretical complication of a pneumothorax, which again is a theoretical complication, and I'll show you a technique that can reduce that uncommon complication to very rare. Now, one thing to keep in mind is this procedure should not be performed in two cases: if the patient's had a past history of breast cancer, or if the mass is really quite deep and difficult to palpate. So those would be the contraindications. Now, I don't use local anesthetic. Sometimes we're going to be using a small needle, and so it's very well tolerated. Sometimes patients are quite nervous, and so if you want, you can use a tuberculin syringe with a small amount of lidocaine, or you have the option of prescribing some EMLA cream, applying it, but then the patient would have to get the prescription filled, and you'd have to wait an hour for that to take effect. So that could slow things down. But anyway, let's move on to the procedure. Now, what you need to do obviously is wash your hands, put your gloves on. And what I do is I prime the syringe a couple of times to make sure that the plunger moves easily. So you have your syringe primed. As I said before, I've already got my cleaning solution and my Band-Aid ready to go. Taking your non-dominant hand, you palpate the breast and you isolate the mass between your thumb and your first finger, and you want to hold that fairly firmly. Then, taking your cleaning solution in a circular motion, clean the skin. Taking the cap off of your needle, holding it like a pencil, you then insert directly into the lesion. You can go directly in, or you can go sideways. Either way is appropriate. I recommend that you don't let go of the mass with your non-dominant hand once you have the needle in place. And what we're going to be doing is, once the needle is in place, is then moving my thumb up to pull the syringe up. And I'll show you once we get in. So I'm holding the mass firmly, skin has been cleansed, you enter in until you feel it enter into the lesion. Moving my thumb up, I then create a suction, and if this was a cyst, we would see the syringe filled with fluid. Often the fluid is a grayish green color, and depending on the size of the cyst, you may fill the syringe up. Now, once you feel that you've gotten all the fluid out, you can milk the mass to make sure that it is completely emptied. You pull back, creating suction, holding the needle steady, and then when that's done, you release the mass with your non-dominant hand, pull the needle out. Putting that aside, you can then apply gauze if you wish, or your Band-Aid. Now that the procedure is over, there's a couple more steps that you need to be aware of. First of all, when you have fluid in your syringe from the aspirate, you do not need to send that for any kind of pathological assessment. All you need to do is just discard it, even if it has blood in it. Then the next thing that you do is you need to palpate the breast. So one of two options. When you palpate, you may not find any mass left at all. If it's completely disappeared, you can A, reassure the patient that this was definitely a cyst, and B, have them come back in about 4 to 6 weeks so you could re-examine to make sure that there's nothing there. Now, if on the other hand, you do palpate and there is still a mass there, something that you can feel, you have a couple of steps you have to follow. First of all, you'll need to send, if the patient's over the age of 35, for a mammogram. If they're under the age of 35, it's recommended you send them for an ultrasound. You also need to set up at the same time an appointment with either a surgeon or a radiologist who's comfortable doing a biopsy. Even if the mammogram comes back normal, you still have to take the second step of making a referral, because sometimes mammograms can be misleading. So this procedure is a very simple, straightforward procedure that you can do in your office. You don't have to send out samples to pathology of any kind, and you have the option of reassuring a patient right away there in your office that everything is fine. Even at the 4 to 6 week follow-up, it's unlikely that you're going to palpate anything more if the cyst disappears initially. Thank you very much.